Welcome to a brand new series through the Global PAD Association. It is called Diabetes and PAD, for lack of a better title. It basically says exactly what it is and tells you exactly what we're going to talk about: diabetes and PAD. My amazing co-host is none other than the incredible diabetes advocate, Mark Brezell. Thank you so much, Mark. I'm really excited about this partnership. I'm excited about all the content and the education that we're hoping to provide, because diabetes is a major risk factor for a disease more prevalent and
Yes.
deadlier than prostate cancer, colon cancer, and breast cancer combined. It's poor circulation in the legs, known as peripheral artery disease or PAD. And in this series, we are going to be talking about the risk factor for PAD, how to reduce your risk of PAD by getting that diabetes under control. And we're going to, share a lot of Mark's perspective, because Mark, you're a diabetic.
I'm a diabetic, 25
Type
years.
1.
I'm a
Type
type
1.
1 diabetic. Yes.
Wow. And so you don't have PAD,
No,
thankfully,
thankfully, yes.
but you have been working your entire life since discovering this diagnosis to prevent any sort of complications related to diabetes.
Correct.
And when you were diagnosed with diabetes, if you can recall the conversation with your doctor in that initial consultation, I know we're asking you to really look back, but a lot of those moments
Mhm.
are remembered because they are, in a sense, milestones,
Yes,
right? You'll never forget
absolutely.
that moment when
Mhm.
you heard the news. Bring us back to that moment and what the doctor said that truly inspired you to say, you know what? I'm taking the reins on this thing and I'm not going to let it get the best of me.
Well, for me, it was rather interesting. If I can kind of step back a little bit before my initial exam, um, I ironically, my background, I'm clinically trained as a cardiovascular perfusionist. So I'm part of I was at the time part of the open heart surgery team. So you have the cardiac surgeon, anesthesiologist, and then my role, which was the perfusionist. And ironically enough, about a year, maybe a few months before that, I was diagnosed. I was approached by one of the anesthesiologists, and we were going to kind of get together to put together. I don't know, he came from a conference and he was putting together a protocol for diabetic patients to try to see if we can improve outcomes for these patients undergoing cardiopulmonary bypass. And so, we started working together, and it's just the irony of it all. As we start to put this together, we start, reading some literature, just doing some things, making some adjustments in algorithms and so forth in practice that I got married in 99. Within 6 months, I started exhibiting weird symptoms. And it's so funny because when you're so focused on something, when it happens to you, it just goes right, right above your head. And so I when I started noticing, these symptoms, it wasn't until the last, basically, a classic symptom, which is frequent urination. I left the hospital. I just went to the bathroom, and I'm like, man, haven't drank much this today. Why am I going back to, And that's what was rather interesting to me. And so I ran to the drugstore, bought one of those, run out urinalysis tests, and it came back positive. It just blew me away. So when I made my appointment to go to my doctor, he was a little surprised himself, because all of my physicals, there were really no real indicators or parameters that gave him a sense of you need to be you need to be on top of this sort of thing. It just kind of came out of the blue. And I just remember, because he was like, you're in really good shape, you're in really good health, you've been active, you've been controlling your, this. I have to say that I'm a little surprised as well. But now we have to manage this. And again, I was initially diagnosed as type 2. So the first step was, let's try exercise and see if you can manage it that way, exercise and diet. Well, I already told him I was a vegetarian. I just had to really cut back on some of the carbs and maybe some of the, you know, uh, I had a sweet tooth, but it wasn't that dramatic. So basically from that, he was just saying, well, let's just see what we can do. And he tried to, we initially went to, diet, exercise that wasn't working. Then he put me on, some pills that worked for a little bit, but that wasn't really working. And when I, got my last, test, my C-peptide came back, and he said, just because he was trying to work with me, he was just saying, Mark, you have something, because he knew I was a clinician as well. So we were just talking in medical terms, and he was just like, I'm trying to think of what we can do to kind of manage this thing, because you're in such good health. What can we do to offset this? And that was the kind of discussion, was that, you're definitely you definitely have diabetes. Right now, it's kind of been transitioning from 2 to 1, because you see peptide levels are changing pretty substantially from the last exams. And so, and then when he told me, boom, you're done, you're not, you are now one, we are now going to have to put you on insulin. That was kind of the, wow, that was kind of an amazing discussion, because again, I could not believe that I was a type 1 diabetic. That just
So
blew me.
how did you go from type 2 to type 1? How
It
does
was
that
just, it was basically, again, every therapy that we tried just wasn't working. I was, the medication that I was on just didn't, it was not, my levels were still, running higher. And we were still trying to see what was my pancreas doing. And so as we're getting regular C-peptide levels, um, it was not consistent. And it was definitely signs of digressing. And so from that particular point, we were, because he didn't want to put me on insulin. And initially he said, well, maybe I'll put you on a little bit of insulin to see if we can kind of keep everything stabilized, and then we'll take you off that and see if you can control it, by your medication, or control it by again, diet and exercise. But it just
Were they
was.
thinking that it was genetic? Do you have a history of it in your family? Do they think that there was some sort of damage to your pancreas
they,
somehow with
they
other
suspected.
medications?
Yeah, they suspected genetics, only because, which is kind of interesting. My brother's also type 1 diabetic. And it's very rare that you have two siblings that are, maybe it's not rare, I don't know. But the fact of the matter is he knew that I had a brother that was type 1. And then my father, he was, late onset type 2, but this was after he was already, older than what I was. He was in his late 60s when he was diagnosed. And so he just controlled his with exercise. He didn't need any insulin whatsoever. So I did have a family history. So obviously the assumptions was genetic, but at the same time, um, my brother, his was induced by medication. He was in the military. He was only about 21 degrees. I mean, 21 years of age, and he hurt his arm, and they put him on some steroid therapy. And within 3 weeks, he was in the hospital. And they, he was actually in Japan at the time. So we get this call that, Doug is in the hospital. They're running all these tests, and they suspected, his sugars are really high. So they suspected he may be a diabetic. And it sounded like he had some sort of reaction to the medication, and just knocked out his pancreas.
So
So
compare how each one of you has dealt with this diabetes diagnosis from you being a clinician
mhm,
and him being a civilian,
mhm.
um, military, now veteran, right? But
Yes.
but compare, do you think that being a clinician has helped you be able to deal better with this?
Yes, yes, and no. It definitely helped me because it, with my clinical acumen, I did notice that in my mind, as I was going through the symptomology of it, as I was dealing with, okay, I had this, and I had this, I had this. Okay, unexplained weight loss. Okay, check. I had this incredible thirst. I did have bouts of fatigue. I think it was. I remember lying down, and the phone rang, and I jumped up to answer the phone. It kind of started me out of my sleep, and my eyes, it was this glare. It's like, it's like somebody was shining a bright light in my face. And I couldn't figure out what was going on with that. Again, not putting two and two together because I'm thinking it couldn't be that. Looking at all these other sources, I said, check my, check my blood, make sure it's not cancer, make sure it's not anything, rule out all the bad stuff, check everything bad. And it came back. So yes, it did help me after I was diagnosed. It didn't help me as I was going through that transition because in my mind, I think sometimes a little, some information, can be a little bit detrimental to you. I think in my mind, I was convinced that could not be the outcome. That was definitely not the case. And I kept fighting. But as new symptoms would manifest themselves, it wasn't until that last symptom when I said, there's no denying it. This sounds like this could be, and that's when I decided to go to the drugstore and check it out for myself.
And once you were diagnosed and you had the conversation with your physician about,
mm-hmm.
okay, I'm a type 1 diabetic now.
Mm-hmm.
I need to be on insulin,
Mm-hmm.
but I understand. Did you understand the potential complications that could arise
Yes.
from diabetes? And what was that discussion like with your doctor to say, I know you earlier mentioned exercise as being one, hey, I got to exercise more, but I want to know from your perspective and your experience, and even versus, what your brother's been doing and where he's at in his journey,
Mm-hmm.
um, not to overstep into his life, but I'm sure
Right,
there's
right, right, right.
general principles that you can share, comparing the two, or maybe he learned from you as
No,
to what is needed.
no, he didn't learn from me. He's the older brother. So the older brother, that's the relationship there is, listen, I'm the one with experience. You learned from me, even though I may have had the clinical back, it didn't matter. But even with that though, now that's actually the case. But back then, no, it was just something that he just grinded through. He just dealt with it. He didn't really talk a lot about it. He didn't. We really didn't sit down, and you would think that two type ones would have detailed discussion about your situation, but that wasn't the case. He never really talked about it much. He just dealt with it. For me, it was the same situation where I just grinded through it. I knew what the potential complications were. That's why I never always want to make sure that I got all my physicals, had all my eye exams and all the various exams, make sure all the, my lipid panels were in line and all that kind of stuff. So I was aware of the long-term complications, but I made up in my mind that I was not going to be a statistic, that I was going to try to do everything in my power to keep my sugar, keep my, my glucose levels as tight as possible. And it's been a blessing to me because of that mindset. After 25 years on the needle, my A1C is still 5.8 right now.
Wow, that's incredible. That is absolutely incredible. To have it under 6
Yeah,
is
and not only
phenomenal.
is it under 6 because my doctor they basically says, Mark, it doesn't really make sense for you to get put on the pump because I know that I still have fluctuations, but I'm so cognizant making sure that I keep my levels down. It's really not worth my while for me to even get on the pump right now. As long as I keep my levels where they are, my A1Cs where they are. So yes, it's very peculiar, or I should say, somewhat unusual, because they're always very surprised. Wow, you have excellent control. How are you doing it? And I'm just
How
saying,
are you doing it?
just paying attention, you
But what
know.
does that mean? Because we have a lot of patients out there that believe that if they're on the insulin, that they can eat whatever they want and then they can just balance out the insulin. So they learn those strategies of
Yeah,
balancing out the insulin, but their A1Cs are not below 6. And
right.
you need them below 6. I hate to say it because even one sugar molecule can
Hmm.
scratch your arteries,
Hmm.
wreaking havoc on your system, leading to
Hmm.
plaque buildup
That's
in
right.
those arteries, leading to narrowings and blockages
Hmm.
that ultimately could lead to leg loss, but
That's right.
also
That's right.
sight loss.
Absolutely. And for me, I think the key is I did understand, and when you look at the pathophysiology, particularly around atherosclerosis and thermomatous plaque, you know that one of the key drivers of all that is inflammation. And so, one of the things that I decided to do was, because there were times where I considered, I grew up as a vegetarian. Maybe, I'm gonna start eating this and eating that, maybe just But as I started learning more about the diabetes that I was dealing with, I decided that I'm going to continue to be, a vegetarian. I'm also going to watch, the amount of carbs and the amount of basically just watch my diet in general. I'm not going to veg out and with that mindset, because when you're early on in the process, that does kind of cross your mind. Hey, I can eat what I want. I just keep my sugar down, and I just veg out, and no real lifestyle change outside of intervention. Outside of that I have to give myself insulin. That was not the case for me. I not only did I want to keep my levels down, but also I want to make sure that I ate foods that will provide, like you said, kind of a foundation of being able to reduce inflammation in my system. I want to try to reduce acidity in my system, and I want to make sure that I ate foods that had a lot of, a lot of fiber and a lot of roughage, because I felt that was critically important to make sure that you flush your systems so that you can reduce the incidence of inflammation that can cause injury to the intimal linings of the vessels.
Let's talk about some of those foods that actually reduce your A1C. One of my favorites, because it's even contraindicated if you are on insulin,
Mm-hmm.
to consume this particular food in high quantities.
Mm-hmm.
Doesn't mean you can't have it at all. You can have
Mm-hmm.
some, but you can't
That's right.
have it in high quantities because it truly is clinically proven to have an impact on your A1C,
Mm-hmm.
and that is chia seeds.
Mm-hmm.
Chia seeds are
Yep, chia
literally
seeds.
clinically proven to lower A1C, which is
Mm-hmm.
pretty incredible.
Yeah, chia seeds. It's funny. My daughter is really big in chia seeds, and I never really was a big chia seed eater. And even now, I eat it, but not very often. For me, I eat a lot of cruciferous plants. I eat a lot of I eat greens, all the different colors, the dark greens versus the lighter greens. I eat a lot of oatmeal, and oatmeal is really oats is a really good for helping to control that as well,
It's
particularly
rich in
control.
magnesium.
Exactly. Along with, and there's other, mechanisms there as well. Like I said, absorbs a lot of it binds a lot of things that help to reduce injury to the lining. So I mean, it's such a kind of a holistic, heterogeneous kind of attack, where it's good for this, but also has a secondary benefit for that. So what for me, I try to eat a lot of fruits. I eat a lot of apples. I eat oranges and pears. I love eating, a lot of fruit. And then of course bananas. What I try to eat that for not only just potassium, helping with my pressure, but it also has other side of I won't say side effects, but other benefits as well. And I think that
Lots of blueberries. Don't forget those.
exactly
High
all
in
the
fiber
vascular.
and antioxidants.
Absolutely. You break down the different colors. You have the purples, but your vascular, blueberries and the dates and the prunes and all that kind of stuff. Um, so I try to eat a lot of foods that will keep me flushed, will reduce inflammation, and I feel that will provide, because my numbers are relatively good. And I think that as long as
Ceylon
I can,
cinnamon is incredible. You mentioned lowering inflammation.
yes,
Ceylon cinnamon capsules are actually
yes,
clinically proven to lower inflammation and A1C, and
yeah,
the jury's still out on whether they have an impact on cholesterol levels, but
right,
some say they do, some say they don't. We have a vascular surgeon, Dr. James Antizana, out of Charlotte, North Carolina, who
hmm,
actually writes a prescription for Ceylon cinnamon. It's critical that you do talk to a nutritionist or a
hmm,
dietitian about any sort of supplements that you want to take,
absolutely.
because especially when it comes to Ceylon cinnamon,
Hmm.
you have to have a very strict regimen of either 2 weeks on or 3 weeks on and 2 weeks off, because it does build up in your system and you don't
Hmm.
want that to happen. So you
Right.
just need to be regimented in terms of your consumption of it.
Hmm.
So it's worth, though,
Hmm.
asking your doctor about a referral to a dietitian or a nutritionist to have that discussion.
Absolutely.
But
And
also
one that
lowering,
also is very familiar with, like I said, natural medicine as well, with herbs, because everybody
an
doesn't have it.
endocrinologist, you would imagine, would
Yeah.
have the experience with it as well, because there is clinical evidence for it.
Right. Right.
And turmeric is another great
Yeah.
one for
Yeah.
lowering inflammation. You
And
mentioned cruciferous plants.
that's right.
Spinach is a really good one.
Hmm.
It's nutrient dense.
Yep.
All those greens are.
Yep.
Also, broccoli is another good one.
Hmm. Hmm. And that's what I try to eat a lot of. I try to
And
load up.
lots of garlic, garlic,
Yes.
garlic, garlic, garlic,
Yes.
garlic, as
Yes.
much as you can stand. Just
I
not
take
much.
garlic every day. I eat foods with garlic, not every day, but as often as I can. And yes, I mean, and it does make a difference. And sometimes it's more efficacious than actually what a test demonstrates. Many times, they just look at numbers. But if you have a diet rich in some of these things, there's a lot going on that they can't really visualize. But that, yeah, go ahead.
I want to go back to the fruit, because there are a lot of people with diabetes, or type 2 diabetes in
Hmm.
particular, that their blood sugar spikes and
Hmm.
they can't eat a lot of fruit, and especially bananas, although they do have some other benefits like potassium and
Hmm.
such. They can't really eat them, and you do want to make sure when you consume fruits that you have a measured amount as per your dietitian or nutritionist for what's right for you, and
Hmm.
pair it with a protein. Pair
Right.
it with an egg, pair it with some nuts that are okay for you to consume as long as you're not allergic, but
Mhm.
making sure that you're eating them together so as to
That's right.
balance things out. I think that that's really important. But I'm
Absolutely.
wondering from your perspective, because if you look on Facebook at
Mhm.
any of the groups that are focused on diabetes reversal,
Mhm.
particularly type 2, you don't
Mhm.
reverse type 1, although
Mhm.
I don't know. I would imagine yours is so well controlled that
It's
um,
there.
it's there. But they talk about the keto diet, and you
Mhm.
see a lot of these admins of these
Mhm.
groups talking
Mhm.
about you need to eat keto, you need to eat
Mhm.
a big plate of eggs and steak and all
Mhm.
this stuff, along with vegetables.
Mhm.
And personally, for me and our stance on it
Mhm.
is, well, what works for you, but our chief medical officer is Michael Danziger, and he's a
Mhm.
diabetes reversal expert,
Mhm.
and he does not like the general keto diet that is
Mhm.
out there that people are using because it's high in fat.
That's right.
And so as long as you are doing it
Right.
healthfully, you like
Right.
the word healthfully,
Mhm.
um, and responsibly, then it's fine. But from your perspective, you decided that you were going to do a vegetarian
Mhm.
diet. I'm wondering, what are the key proteins in your diet, and how do you manage that to make sure you are getting enough?
Well, I eat a lot of soybeans and soy-based products. It's interesting. Somebody was arguing with me one time. We were having, well, not arguing. Let's just say that we were having a very detailed discussion around that. But what's interesting is that many people have pushed back on, recently there's been some data trying to push back on the benefits of soy. But the interesting thing about that is that when you look at certain diets and that people, whether it's the Mediterranean diet or whether it's the Asian diet, whatever, you look at the historical perspective. And I'm thinking to myself, okay, wait a minute. If soy is so bad for you, how is it that Chinese women have the lowest incidence of breast cancer? How, which they attribute it having its hormonal, implications. And when you start looking at all that, you have to again look at how is it processed. Again, it good old, it's not the plant. It's how it, when you deal with commercialization and they try to mass produce anything, now you're adding factors and cofactors that are not intended to be consumed. And that's where a lot of the problems come when we try to make a buck as opposed to being more focused on health. Then you can get off the rails and
I
start.
think that you bring up a really important point because we had this discussion with our chief medical officer, Dr. Danziger, and he does like soy products. And he said it's a key staple for his diabetic patients that he works with in terms of reversing diabetes by making sure that they are getting enough protein and
Right,
pairing that with the right cruciferous vegetables, etc.
right.
Um, but he leans less towards the real processed soy products.
That's
You
right.
can get
That's right.
a very healthy soy,
That's right.
a tofu
That's right.
that is out there. But when you're looking at the big manufacturers and the highly processed ones with a lot of other things in
Right.
it and in facilities that produce other things and
Right.
whatever else, well, then you're kind of getting away from
That's
the
right.
natural aspect of it.
That's right.
And you also have the issue where soy is overproduced as corn is
Right.
overproduced
Right.
here in the United States especially. And so you
Yes.
really do need to take care in the types of products and the quality of products
That's
and
right.
the brands and do your research on them.
Absolutely.
I
Absolutely.
know it's tougher though, as
Yes.
you can imagine, for people who are
That's right.
lower income. What is your best advice for those who may have to shop at even the dollar store to
Yeah.
get some of their prime products for food?
I think the best way to deal with that is you have to go and to a Whole Foods location. I know that even it could be even sometimes like Whole Foods or some of these other places can be maybe expensive, but if you somehow can, that to me is the closer you get to nature, the better the outcomes are. And even when we talked about the people who are sensitive to having sugar spikes, if you eat the whole fruit, it's already designed to have cofactors in it to keep your sugars from spiking to that level. And so a lot of times, when you bypass that, a lot of people are juicing, they drinking smoothies and that sort of thing. A lot of that, sometimes you remove so much of the fiber that with the fiber in a lot of these particular products is what keeps your sugars at a nice latent increase. Doesn't prevents a lot of the spiking. So I think that so many of us, I should say, so many of us, and now we try to bypass the whole fruit, and we consume remnants of the fruit. And I think that's where you have to kind of be careful if you want to maintain that nice gradual increase in your blood sugar levels.
So, what does a day of meals look like for you? And I'm glad that you had mentioned oatmeal because my dad was on Cheerios and
Mhm.
he listened to the commercials. Hey, part of a heart healthy diet.
That's right.
But they don't consider that it's full of carbs
Yeah.
and it spiked
Processed.
his blood sugar, processed, and he
Yeah.
ended up with type 2 diabetes.
Mhm.
And that led to damage to his artery walls with this
Mhm.
sugar molecules. As I said, if you recall,
Mhm.
one sugar molecule can wreak havoc on your artery walls, leading to plaque buildup,
Mhm.
narrowing, and blockages. And
Mhm.
that's really, it wasn't just the Cheerios.
Right. I know. I know. I know.
But I could tell you that when he switched to oatmeal, and what he would do was we made a special oatmeal. I prefer the steel cut oats in terms of I
Mhm.
think that they're less
So do I.
processed, right?
Yep.
So he didn't really like them as much, so I put the regular oatmeal with the flatter, I don't forget what you call them, but the regular oatmeal with
Uh,
the steel cut,
yeah.
and I
Yeah.
would make a quarter cup
Mhm.
of a mix of those, 3/4 of the steel
Mhm.
cut, but then a quarter of the other.
Mhm.
And then I would add, grounded chia seeds,
Mhm.
grounded flax seeds,
Mhm.
some creatine powder, some collagen powder with
Mhm.
MCT,
Mhm.
some Ceylon cinnamon
Mhm.
in it. And he absolutely loved it. And then we would heat it up and add some blueberries, some
Mm,
strawberries, some raspberries, blackberries, whatever
yeah.
berries he wanted, and
Hmm.
some crushed walnuts. And
Mm,
he was able to lower his A1C just like that. I mean, of course, we made
interesting.
some other changes,
Right.
eliminating sauces, reducing carbs, et cetera, et cetera. But I
Mhm.
think that the oatmeal made a huge difference. So I'm glad
Oatmeal
that you
will
brought that up.
make a big, absolutely, oatmeal will make a big difference. It's outstanding for vascular health, and also has properties in there that actually binds many of the contributing factors to anthrombinous plaque itself. So even if you're starting to accumulate some of that, some of these foods, again, on top of oatmeal, even the simple thing of drinking a lot of water, staying hydrated, all that helps with, there you go, all that helps with the balance of flushing your system. You remember our original, we can survive off fruits, nuts, and grains. People say, well, that's impossible, but our bodies were designed for all that. But now that we have added, some of these other factors and variables, but the fact of the matter is that, yes, I think when we keep our diet simple and we stay away from, I think the biggest detriment here in the United States is processed. Because for me, I find it interesting when you look at some of these third world countries. Majority of, even the ones that are dealing with diabetes, they're dealing with diabetes because of more so malnutrition and a lack of nutrients here or there that's contributing to dysfunction. Versus here in the United States, our good old American diet, you have people coming from other regions, the geologies, coming here, and then within 5 years, in fact, it's so interesting for me when I was, my wife and I went on a cruise last summer. We went to Greece, and we noticed that we were there for a week, just over a week, and we lost weight. And I'm thinking, wait a minute, how could this be? And it's interesting. In fact, I just had a friend ship me some actual real virgin olive oil from Lebanon, because he was from Lebanon, and they just shipped it to me. Actually, I just got it about a couple of weeks ago, and even their olive oil is so different than what we eat here in the
You
United
made it
States.
actually taste like olives. I have a
Yes.
challenge for you. I would like you, and I want you to do a video of this, to take your regular olive oil off the store shelf that you already have in there
Mhm,
and your new olive oil.
mhm,
And I want your wife to actually blindfold you
mhm,
and do first a smell test and point
mhm,
out which one you think is the real olive oil.
mhm,
And then to do a taste test. Of course,
mhm,
you're going to get the taste because now after you've smelled it. But
mhm,
I did this and I actually they shared with me first the regular off the store shelf one.
mhm, mhm.
And I
That's
was like,
supposed to be
that's olive oil.
super virgin. It's
And
supposed to be high premium.
it's rancid.
Mhm,
After sitting on the store shelves, it's rancid.
mhm,
And so we started working with a company called Amphora Nueva,
mhm,
AMPHORA
mhm,
amphoranueva.com/Marin, MARIN.
mhm,
And it's through, I think it's Victoria Foods, I think is their main
mhm,
company. And then they have Amphora Nueva is their
mhm,
different distribution networks in the Bay Area, the
mhm,
shops. But they also have other shops they distribute
mhm,
through across the nation. And in those shops, it's theirs because they bottle the olive oil right there
mhm,
and they change them out every
mhm,
3 to 6 months
mhm.
for only the freshest olive oil that you can get. And they
Interesting.
train the growers in
Mhm,
how to make sure they have the healthiest soil
mhm.
for these olives.
Yeah.
And then in terms of the processing, they make sure that their first harvest or early
Mhm,
harvest
mhm,
hand picked versus, I always
mm.
joke, shake the sugar tree
Yeah, yeah, yeah,
instead of
yeah.
shaking the olive tree. And
Yeah.
when these olives drop,
Mhm,
they lose their antioxidants because
mhm,
the olives are having to heal in a sense, right? The
mhm,
damage to the olives,
mhm,
which I
mhm,
I don't know the entire process. I can only tell you in basic
mhm,
terms my understanding from
mhm.
what the olive
Listen.
experts have told me.
Mhm,
But so first harvest, hand picked, cold pressed,
mhm,
extra virgin olive oil,
mhm,
and it will kick you in the throat. And
mhm,
so for those who are watching,
mhm,
if you mention DSO, On the Global PAD Association, you'll get 10% off. But that's where we go and we get the healthiest. They were clinically proven 3 years straight, 3 years straight with
Wow.
the healthiest olive oil in the world.
And
And
it will
that
definitely make
particular
a
one is the
difference.
Kalamata oil.
Hmm.
And one of the foods we didn't mention was actually apple cider vinegar, and they bottle their apple cider vinegar right then and there for you
Wow.
as well. And
Wow.
so I use that. I actually
Yeah.
have a shot of it every single night.
Nice. Yeah, that's some good stuff. Like I said, and that, and again, when you're talking about inflammation, turmeric. Turmeric is it's such a powerful herb for maintaining the balance in your system, particularly around inflammation, and also helping to keep it bite a little bit more neutral and not as acidic, because obviously so many of our foods that we eat, and a lot of the processed components that are in the foods that we eat lead to very acidic environment in our systems, and that's where a big contributor as well to arthritis generation and plaque that forms in our system. So yeah, it's a very cyclical, and it's very it's amazing how everything is so centered around our diet, and it's it just opens up so many doors in a good way, and unfortunately it can cause a lot of problems in a bad way when you're consuming things that your body has difficulty trying to break down and
And I
metabolize.
love that you mentioned turmeric because our nurse practitioner, Deidre Arms,
Mhm.
we have a series called Ask NP Deidre. It's every Wednesday.
Nice.
And here on our YouTube channel.
Mhm.
And she was talking about turmeric being one of
Mhm.
her top three, that
Mhm.
if she didn't take any other supplement, it would
Mhm.
be turmeric, and making sure the turmeric, it, has the bio pairing, has the
Right.
pepper
Mhm.
in it
That's right.
as
The black
well.
pepper. Yeah.
And
Mhm.
the one that I've been doing, I've been buying all
Mhm.
the different ones
Mhm.
online to see if, I can experience any sort of
Mhm.
difference with my inflammation in my body. I'm
Mhm.
in a positive
Mhm.
autoimmune.
Mhm.
And so the biggest difference that I saw was
Mhm.
with a turmeric supplement called Pause, Pause.
Okay.
And when you look at it, you can see the
Mhm.
turmeric kind of going back and forth. It's in a little bit more of a liquid
Mhm.
form. And I
Mhm.
really feel like it made a
Mhm.
difference. I mean, my
Yeah.
numbers show, and I didn't
Yeah.
make any other changes, but
Yeah.
taking two of those today a
Mhm.
day along with
Yeah.
fish oil,
Yeah.
I think it made a
Mhm.
huge difference in the inflammation in my body.
All that makes a difference. And I think that when we are at the mercy of our palate, and we just eat foods that are laden in fat, that are highly processed, it's just, and I tell people all the time, think about what you're eating, that tastes the best. A lot of times when you eat some healthy stuff, people are like, well, if it's healthy, it doesn't taste good. Yeah,
Mhm.
but which is true. One of the plants I think that's very very important for diabetes is bitter melon, and bitter melon. Yeah.
We have a
It's good for
wonderful
you.
friend in the Philippines
Mhm.
that showed us, and if on our YouTube channel, youtube.com/, the @ the way to my heart,
Mhm.
we had Don
Mhm.
actually do a demonstration on how to cook it. And I
Mhm.
cooked it along with him for our Foodie Friday,
Mhm.
which if you cook, we should get you doing a Foodie Friday with us. You teach
Yeah.
us how to do a
I'm not much
recipe,
of a cook,
your
but
favorite. But that makes it more fun.
I'll
If you
taste it.
smell things like I do, it's fantastic. Good
Yeah.
TV, good
Mhm.
TV.
Yeah.
But he did show that, and he showed us how to clean it, and it was a lot of
Mhm.
work,
Mhm.
but it
Mhm.
actually worked really well
Mhm.
if I put it in my smoothie. So I
Mhm.
measured it, and I put
Mhm.
lots of strawberries in there,
You're gonna
lots
have
of
to put
green.
lots of something.
It's bitter, but it's really healthy.
Yes, it is.
It's
It
just
is.
like a tart cherry. I'd rather have a
Yeah.
sweet cherry,
Yeah.
but it's the
Yeah.
tart cherry
Yeah.
that is actually healthy.
And it's interesting. What was interesting, what the phytochemical in bitter melon, it's actually like a plant insulin. Molecularly is very similar to synthetic insulin. And so when people eat that, it lowers their sugar because it has a very similar, even more efficient effect as natural, as synthetic insulin. So that's one of the reasons why when people have eaten this, their blood sugars are much more moderated, because again, it's almost like you're taking some of the some of the various medications that actually cause your pancreas to excrete more insulin. And so it's really, yeah, is that. And then there's another herb that I also recommend for diabetics, whether you type 1 or type 2, is Gymnea sylvestre, which is an Indian herb. Gymnea is again, it really is a full tonic for people with even with your pancreatic function. If you have some function, it definitely will help. But even if you don't have active pancreatic function, again, it helps your body with the metabolism again, breaking down. As you're taking your insulin, it helps to increase insulin. Since I should say, it decreases insulin resistance and it increases insulin receptors to to trying to break all this stuff down and utilize it much more efficiently. So there's a lot of things out there that modern science, they're still catching up to some things, but there's a lot of natural things that people have been eating for generations, and now we're starting to discover that, wow, this stuff really I never
It's
really
really
knew
hard
that.
though for a lot of people to get a hold of. You'll have to spell the Indian herb as well, but with the bitter melon, it's really hard to find. I know we have one store, and it's a special Asian market that we go to to get it. But for
Yeah.
a lot of people, there was actually a study I'd read that patients who consume 2,000 milligrams
Mhm.
of a bitter melon peptide capsule
Mhm.
lowered their A1C significantly.
Yeah. Wow.
And if with all these results, it's so crazy that they don't incorporate these into our traditional medicine.
Mhm.
Again, I just want to have our disclaimer: always check with your own healthcare team
Absolutely.
before acting on anything
That's
we're
right.
talking about here.
That's right.
You need explicit consent from your healthcare team
That's right.
before acting on any
Because
information that we're providing. We're having just a great discussion,
that's right.
really informative discussion, hopefully
Mhm.
giving you some food for thought so that you can go back and have a more productive conversation with
Yes.
your doctor. Get that referral to the
That's right.
nutritionist or
That's right.
dietitian. You
That's right.
need to request that. They don't always offer it. You need to request it.
Mhm.
You
Mhm.
need to request, you could even request a diabetologist
Mhm.
referral
Mhm.
as well. And they would be the perfect people to have these discussions with to determine
Absolutely.
what's right for you.
And disclaimer is totally accurate from the standpoint, everybody's different. Every system is different. Nobody's exactly the same. Some people are very sensitive to medications. Some people are very sensitive to herbs. Everybody is different. That's why you, like I said, stay in consultation with your healthcare team, and what works for you. I remember for me, they put me on Questor to try to lower my they said because I'm a diabetic, because it kind of keep my levels down, because it was elevated a little bit. But even sometimes the elevations with those tests, sometimes some of the anatomical changes that are going on internal inside the body may not necessarily be what's representative in the test that is demonstrated. But anyway, aside of that, that particular medication for me um, caused me to have serious complications and side effects. In fact, one side effect, I remember I was on it for not even a week, and I noticed that my head would spin. If I closed my eyes, I would get vertigo. I just felt unsteady. One time I was getting up from off my knees, and I almost fell out, to the point where I was when I got to I went over to my dresser. My wife was in the room, and I started laughing. We said something funny. I started laughing, and I completely passed out. I mean, literally, there was no holding. There was no. It just 1 minute I'm standing, the next minute I'm just on the floor, and I feel like a
Uh-huh.
tree. And I went to the doctor, and they evaluated me and said, "Well, we can't find anything wrong with you." Um,
That
uh,
must have been a wretched evaluation. I mean,
yeah,
comprehensive, talk about brain scans, everything
yes,
else, and a,
yeah, yeah,
trip to the hospital and
yeah.
with the blue lights.
Yeah. And when I woke up, well, I should say I didn't really pass. When I got up, I was fine. I didn't even, I said, well, I'll go get it checked out. I mean, I was fine. It's just like I just came right out of it. It's no issues. And so I'm thinking, so when I went to the doctor to be evaluated and they ran, some scans and everything came back negative, I told my doctor, I said, I was fine prior to you putting me on Questor because I'm very sensitive to when I say talk about drug interactions because that happened with my daughter. They changed their medication. She was asthmatic. They changed their medication and they put her on a different medication, and she became extremely hypersensitive, and to the point where things that she were as allergic to would actually cause her to go into anaphylaxis, and she would actually have to give her her EpiPen and take her to the ER. This happened 4 times before we figured out what the cause. It's because of her medication. They switched it. And in fact, her pediatrician argued with me saying that it couldn't be the medication. I said, well, give me a second. At the time I was a medical science liaison. That was my vocation after I left the hospital. And so I went and contacted the company's medical affairs department. I asked this very concerted question. My daughter is having this problem. Can you go through the literature and find out, give me your product information, so we just kind of went through item on item. And then it was like the one near to the end, it said 1% or 2% hypersensitivity. I was like, bingo, got it. So she called, she sent me the information. And, just because she's a low percentage doesn't mean she's, the fact of the matter is it manifested. And so I went back and told her doctor, I said, this medication, so we're getting off this, let's try something different. But most people wouldn't even think to know that. You wouldn't contact a company and say, hey, is this, you will deal with these things. And a lot of times they'll argue with you saying, you need this, or this is necessary. So my I guess this the moral of this story is that always ask questions. If you're there with that child 24/7, or you're there with or you yourself personally, when things are not are out of the ordinary. Yourself better. You know yourself better than any doctor, nurse, therapist. You know you. And if something's not right, if there's some gut feeling that you have, you need to follow up on that, because I'd rather be told that there's nothing going on than for you to have some dire circumstances when you knew that you had a gut feeling that something wasn't right. So things, if it feels like it's out of the ordinary, or get it checked out. And I always recommend, and we were talking earlier, always consider a second opinion. Nobody knows everything. Everybody has a different course of experience. No one has seen everything. So just kind of spread your wings and don't always take the first recommendation.
That's actually the best way to describe. I mean, we get pushback from quite a few people when it comes to second opinion. Oh, I like my doctor. Oh, do you know the pedigree of this doctor? Oh, have you seen their Google reviews? Oh, they're the head of the department. And oh, they're at a large teaching facility that's famous. And I always say that doesn't matter. That does not matter. Not one of those things really matters, because while they might be great, not everyone knows everything. Different doctors, different tools, different techniques. It doesn't even mean that they have the greatest of all techniques. There could be a lot of reasons why they don't
have a
have
negative
something
either.
that's new, right?
Right. Mm-hmm.
I mean, I experienced that a lot with peripheral artery disease,
Mm-hmm.
that a lot of doctors, meanwhile, a lot of great skilled doctors everywhere, but it doesn't make them less skilled or less talented because they don't have a new cutting edge tool or technique. It's just they might be educated differently.
That's
And
right.
they might not have access to a new trial. They might not have a relationship with the founder of a new device, or they might not have been part of that conversation with someone, let's say in Germany,
That's right.
where they had a particular patient that taught them a valuable lesson, and it's slowly actually making its way out of Europe.
Yes.
You just don't know. So it's always worth getting a second opinion, because why? Not everyone knows everything.
Everything.
It's not
That's right.
possible.
That's right. And sometimes, they haven't seen, some doctors haven't seen it presented in their practice. Sometimes, you've had many doctors will say, well, this is my first time seeing this, and there's always a first time for everyone. And so I agree. Second opinion is critical when you're not getting results.
And I also wanted to go back to something else that you said as well, when you were talking just a moment ago. I mean, the importance, of advocating for yourself,
Mm-hmm.
asking the questions. It's so important,
Mm-hmm.
especially when you're not getting the answers.
Right.
You've got to keep
Right.
asking the questions because you know your situation best. One
Right.
of my pet peeves is, well, that's really rare. You couldn't have that.
Right.
And I will tell you from experience, my dad is the 1% of everything. Every single medication,
Mm-hmm.
he is going to be that 1%
Mm-hmm.
that is going to get some rare side effect.
Mm-hmm.
And it happens every
Wait,
single time.
my
And they
wife is
always
like
say,
that.
no, 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 it can't
That's
be
right.
the medication.
That's right.
Well, it just might be the medication,
That's right.
and you could be that 1 or 2%. So
That's right.
it's worth pushing.
Yeah.
It's your life, it's your limb on the line.
That's right.
You can't back away. You can get in there and you
That's
can
right.
finally
That's right.
push for the
Remember,
right answers.
remember, medication is synthetically produced, so everybody's body doesn't handle certain medications like everyone else. I mean, so there are certain things, we're all different. And so our bodies might not, that might be, we might be, like you said, one of that small percentage that our bodies doesn't metabolize it like your body would. I mean, so that's why you have to at least examine those options just to cover all your bases.
And we have just a few more minutes here. I want to get to, it's really important when it comes to diabetes,
Mm-hmm.
the making sure you're diligent with your medications, making sure you have the right diet and you
Mm-hmm.
stick with it. But number three is exercise. And it's
Yeah.
so important. And it's comforting to see that, or exciting, I should say, to see that the semaglutides, the GLP-1s that are semaglutides, the
Mm-hmm.
Ozempics, Wegovy, et cetera,
Mm-hmm.
that through the STRIDE trial, they proved that because these drugs reduced inflammation and because they lowered the A1C,
Mm-hmm.
they they tended to improve the walking distance
Mm-hmm.
for patients who were considered claudicants, meaning they had leg cramps,
Mm-hmm.
which were indicative of peripheral artery disease or poor
Mm-hmm.
circulation in the legs.
Mm-hmm.
And walking's the best medicine to grow
Mm-hmm.
those collateral vessels.
Mm-hmm.
But if you're not walking, you're not going to improve your prognosis with it. So
And
it was really exciting to see that those drugs really helped with that as well. But for you,
absolutely. Now, I'm just going to say that walking is it's the jump start of all of this entire process, and supplementing with that with cayenne pepper is also a benefit because cayenne, increases circulation and increases endurance, and also, like you said, it can help the body, as your vasculature is along with all the purples as we talked about, bilberry and blackberry and blueberry and all of those, that along with cayenne pepper, which is kind of a, how can I put it? It's kind of a, remember the commercials we used to see, EF Hutton, it makes it better. That's what cayenne pepper does. It actually potentiates the effectiveness of other components that you take along with it, even with exercise. In fact, they've done some studies that Mexicans, for example, had lower incidence of hypertension because they were eating a lot of peppers. And so this also helps with in diabetes as well. You want to walk, and I tell people all the time, you don't need a gym membership for health. Your neighborhood is your track. just go out and walk. Just, you don't even have to, just start small. Just start small. You don't have to, go the, you don't need a membership. You don't have to start jogging. Walking is one of the most effective exercises that you can do. Just walk. Fresh air,
your calf muscle
sunshine.
is your second heart. So the
That's
more
right.
you're pumping it, the
That's right.
more you're not only benefiting your leg
That's right.
circulation, but also your heart circulation.
Heart
And
circulation, and also being out there in sun,
Yep.
The vitamin D, all
D3.
was
Yep.
that?
The vitamin D, that is the missing piece. There
That's
was
right.
a study during COVID that they were saying, one of our cardiologists said that 80% of the major complications that were studied were in patients that had low levels
Low
of
D levels.
vitamin D.
That's right. That's right. Absolutely. And you can't
Go
beat nature.
soak up that sunshine.
That's right. So between that's why I said fresh air, sunshine, increasing oxygen, exercise, increasing, the heart tone and circulation and all that. And then the final piece, and which is something that people completely disregard because they don't really, there's not a lot of studies that deals with it, is sleep. A lack of sleep impacts your glucose levels.
Hmm.
People don't realize that. So if you're diabetic, well, actually, I encourage anybody, you need rest because that's where your body heals itself. There's no greater time of healing and restoration than sleep, than rest. And when you can get a good REM sleep, your body is particularly for someone that has diabetes, that has all of the other complications or potential complications down the road. You need your body to heal itself, so that helps to ward off a lot of these challenges. So on top of all the things we talked about, make sure at the end of your day you go and get yourself a good night's sleep, good night's rest.
And YouTube has some great meditations if you go on there. There's also, you can download the app Headspace, but
That's right.
I like the free videos and I can get a
That's right.
variety of them
That's right.
that you can use. And I fall asleep to some of them. When you find the ones and that
Yes.
voice that works for you, I
Yes.
end up falling asleep like 10,
Yeah.
15 minutes in, I'm out.
Yes. That's right. That's right. And it's a good thing. You wake up refreshed and ready to go.
And finally, maybe we should have addressed this in the beginning, but what is a cardio perfusionist?
A cardiovascular perfusionist he's a specialist um,
Or
who
she?
focuses on cardiopulmonary bypass. So we know that when you undergo heart surgery, if you have, whether they're replacing vessels or replacing valves, or if they're bypassing blockages, because I call myself we're human plumbers, but basically what we do is they have to actually stop the heart from beating to operate on the heart. So while the heart is stopped, we're the ones that are flowing, that are pumping the blood into the patient. So they cannulate. There's certain parts of the heart where they cannulate the aorta, so the blood goes in there, and then they take blood out of the superior inferior vena cava. They'll take the blood from there, they'll put it into the machine. Machine will oxygenate the blood, take off the CO2, give them other nutrients that's necessary, and then they put the blood back into the patient. So while this heart is flatlined, that's how they're able to keep blood pumping throughout the rest of the body and the brain. And so we have to preserve the brain and make sure that everything is pumping properly. So that is actually the role of the cardiovascular perfusionist.
So you are the heart of the
We are the
OR.
heart and lungs. That's right.
I love it. So as we move forward, I would love for our series to continue. I would love to continue this conversation
Yes.
and even invite other friends that are out there
Yes.
that have stories to share,
Yes.
whether it's endocrinologists or vascular specialists or
Absolutely. Yes.
diabetologists,
Mm-hmm.
nutritionists,
Mm-hmm.
even patients. We would love for you to come and share your
Yes.
story
Yes.
and
Yes.
join us
Yes.
in this series. I think we're going to try for
Yes.
once a week, or are we doing once a month here?
Well, what works with you guys? We could try maybe once a week to see what the response, and then I should say once a month, maybe twice a month, and then we see where that goes.
Yeah, no, I agree. So join us in a couple weeks.
Mhm.
Make sure that you like this video. Let us know that you really like this video and you want more of it. And let us know in the comments section what other topics you'd like us to discuss within the parameters of diabetes and peripheral artery disease, and
Right.
maybe who you'd like to see us interview as
Mhm.
well.
Yes.
So you can do that, but subscribe to our channel, get notified for the next diabetes and pad discussion.
Mhm.
You don't want to miss that. And other amazing content right here at youtube.com/the @ sign The way to my heart. Thank you so much, Mark, for joining us. Mark Brezell, any
Yeah.
final thoughts as we close?
Well, I just want to encourage, one thing that I enjoyed about this discussion is we want you to know that you're not by yourself in this struggle. And that's what this whole venue is all about, is so that we can discuss challenges that you may be dealing with, because what you're going through, somebody else is going through as well. And your testimony and your sharing your experience will benefit someone else. Because sometimes you get isolated to thinking, I'm the only one dealing with this. Well, you're not. And that's what we're here to kind of encourage you, let you know that what you may be dealing with, somebody else is maybe dealing with, and they can kind of encourage you to hang in there and keep up the fight. And my final piece is that I encourage you all to check out my book. I'm a recent author. I wrote a book, A Matter of the Heart, my unique and unexpected journey with diabetes. And basically, I wrote that because there was something that we didn't really talk much about, because we were focused on the lower legs, is the impact, the emotional impact that diabetes has on patients. Because diabetes is more than just the physical, it's also the emotional. And so I just want to encourage you all to, come back and share your experiences, like she said. And I think that, we can really use this as a great forum to educate, uplift, and encourage.
And I think you have just solidified our next in the series. We are going to be talking about your book. We're going to be talking about the issues in your book and hopefully inspire people to check it out further. But I think it's a really important topic when you're talking about a matter of the heart and the
On
psychological.
Amazon.
It's on Amazon. So make sure to pick it up, because we're going to have a book club coming up
Yes.
in the next 2 weeks. So you want to get a head start. And I think
Yes.
that that's what we're going to do. Is we're going to talk about the book. So I'm going to get it. I'm going to read it. And hopefully you guys